Hi everyone, my name is Michelle and I am documenting my journey fighting metastatic triple negative breast cancer and subsequently secondary adrenal insufficiency. So let's see, we are 2 weeks out from my very last chemo and I figured I'd do just a little recap and update. Nothing really new to report yet. I did meet with the surgeon and the medical oncologist yesterday. So, but nothing has changed since my last update, but I'll just do a little recap on that. And then I'm going to talk about adrenal insufficiency today and what I've been learning about that. So just to recap cancer, my diagnosis was July 18th. And we started in August with chemo. I did 12 weeks of paclitaxel and carboplatin once a week. And then I did 8 weeks of adriamycin, doxorubicin. Adriamycin and doxorubicin are the same thing, which is also known as the Red Devil, and Cytoxan every other week for those 8 weeks. So there were 12 treatments of the Taxol and carboplatin, and then 4 treatments of the adriamycin and Cytoxan. We also did Keytruda immunotherapy, which was starting with week 1. It was every 3 weeks, with the last one being that I did being the first at the same week as the first adriamycin. And the Keytruda is what shut down my adrenal glands. So that's one of the reasons we stopped, along with a couple of other autoimmune issues that it seemed to aggravate. And so we stopped that. November 14th was the last one. So chemo is done. My MRI shows that there is no evidence of the tumors left. And we move on to surgery. Surgery will be January 30th. We're going to do surgery on the left breast, which is where the 2 tumors were in the breast and in the lymph nodes. They're taking out the affected lymph nodes. They're going to look at them in the operating room. If there is no evidence of cancer, then those are the only 3 that come out. I think there's 3 that are coming out. And if there is evidence of cancer in the lymph nodes, then they're going to take the rest of the lymph tissue in that armpit area, just to make sure that they get it all. Same thing kind of in the breast. They're going to take all of the tissue around the biopsy clips where they identified cancer. That's all going to go to pathology. And as long as that's clear, then I'm done with cancer treatment because we got it. We got it all. And that's what they anticipate. They said if there is any evidence of cancer, or then they could go back and take more, or we could talk about like restarting Keytruda or doing an oral chemotherapy for 6 months or a year or something. But that conversation would happen depending on that pathology, but they don't anticipate that to be an issue, which is awesome. After surgery, there's a recovery period of about 4 weeks, and then I will have 5 weeks of radiation on that breast, which will continue to change the shape and size of the breast potentially. After another 2 months or so of recovery after radiation, then we'll know the shape and size of the breast, and then the plastic surgeon will do a breast reduction on the other side so that they match. And so that will be the rest of the cancer treatments. Now, with the adrenal insufficiency, what I'm learning is that it's all just a big old guessing game to find what I need in the way of steroid replacement. So, and just again, to recap, the immunotherapy shut down my adrenal function. And so from what I understand, my adrenal glands do still work, although we did not do a stim test yet. I imagine at some point we probably will, just to confirm this. But the endocrinologist, they've seen this before. And as she explained it to me, my pituitary is no longer producing the hormone that tells the adrenal glands to produce cortisol. And so that's why I have no cortisol in my system. My body's not making it anymore. And so that is called secondary adrenal insufficiency, or central adrenal insufficiency was the other thing that she termed it. So it's not Addison's disease, which is primary adrenal insufficiency, where the adrenal glands themselves just aren't doing anything. Although this is all, they're still doing testing without modifying my medications, because my body is under stress still from chemo. Even though I'm 2 weeks out now, my body is still being stressed and taxed from the effects of the chemo, which is cumulative, and it's going to take a few months for that to work its way all the way out of my system. So I'm still on a higher than what will probably be the normal dose of steroids. For now, I am taking 20 milligrams of hydrocortisone at 6 o'clock in the morning, which is before I get out of bed, and 10 milligrams of hydrocortisone at about 2 p.m. And then she said if I feel wonky, if I feel like I'm getting a cold, if I have a fever, if I feel just that I'm going to be up late, I can take another 5 sometime around dinner time, just to kind of make sure I still have energy through the evening, and to help my body compensate. If I feel like I'm getting a cold or anything, they actually recommend doubling your dose for several days. And it's all based on how you feel. There is no test to do. So like, for example, last week on Tuesday, I had taken, as directed by my endocrinologist, 5 milligrams at 2 p.m. And in the evening, I had a little stomach ache. And it was just a stomach ache. Like, I thought, well, I'm still kind of dealing with a little constipation from the chemo. I really kind of didn't think anything of it. It also didn't have an appetite for dinner, which is unusual being on steroids, because I'm hungry all the time. But then I looked, and they had tested my cortisol that day in the afternoon, and it was low. It was only 1.7. And so I thought, oh, well, maybe my cortisol's low and I should take extra. So I took an extra 5. And I didn't really feel better, but I did sleep that night. So I basically went back up to 10 the next day. I didn't think I was quite ready to go down to 5. If that stomach ache perhaps was an indicator of low cortisol. It's just a guessing game. There's no meter. So like, it would be so much easier if I could say, gee, I don't know. I don't know if it's gas or what it is. I have this little stomach ache. And if I could like prick my finger and check my cortisol, like you could check your glucose, that would be so much easier. But that is not available. So it's just based on how you feel. Take extra. They say if you're in doubt, if you feel at all like a little off, just take extra, because it won't hurt you. Which, I don't know, that's just such a paradigm shift for me, to just take more meds. Like, that doesn't come naturally to me, and it just doesn't fit with how I view medicine. So that's a paradigm shift for me. That's something for me to get used to, for sure, to be able to easily just say, oh, I'm just going to pop an extra pill. That just doesn't come naturally to me. So we'll see. I'll keep you posted on that part of the journey. But for now, I'm on hydrocortisone orally, and I see the endocrinologist again on the 22nd. So we'll see what she says. I know there will be stress dosing involved for the surgery, so we'll go up to a much higher rate, at least the day of the surgery, and probably then taper back down the days following the surgery. And that's about it. So we're coming up on 10 minutes for this video. There's one other thing I wanted to say. I've joined a few support groups. So like on Facebook, there's a breast cancer support group or two. There's hidradenitis is another issue. That's the other autoimmune issue that was kind of flared with the immunotherapy. And there's a support group there, and the adrenal insufficiency support groups, just so that I could learn from people that are living with it. And I see a lot of comments of people that just, they get so upset when family members or friends, you know, tell them to keep a positive attitude or something. And I love that. I love when people remind me that your attitude is a big part of it. That doesn't bother me, but I know it does bother some other people that are dealing with cancer or some other chronic condition. And I just want to say, you know, it's very easy to beat the drum and get stuck in a victim mentality and to think, oh, poor me. And certainly, you know, I have my moments of, why did this happen to me? Of course it happened to me. Being angry, feeling sad about the fact that I have to take medication for the rest of my life. There's moments, certainly, and I recognize that and acknowledge it and, you know, sit with it for a minute or so. And then you have to let that go, because it's so easy to get stuck in that and feel depressed and feel like a victim. And I have no interest in that. I don't want to be a victim. I don't see myself as a victim. I got cancer. This happened to me. Yep. And we're going to kick it out. And okay, this adrenal insufficiency, this happened to me. There's a reason. I don't know what the reason is, but this is the next chapter. So this is this worrying about it, being upset about it. Okay, you can be upset for a moment. You can honor your own emotion, and then you wrap it up in a bow and let it go, because worrying about it and feeling bad about it is only going to make you feel worse. It's like, all right, let's put that away now. And then we're going to move on, and we're going to look for the positive. We're going to look for something that's good. It's really great that I had that adrenal crisis at home after chemo, because if I had an adrenal crisis on the operating table and they didn't know that I was adrenal insufficient, then that could have made that surgery so much more traumatic. It could have potentially caused that surgery to be fatal, because my blood pressure would drop and they wouldn't know why. And of course, my surgeon, telling my surgeon this, she's like, no, we would have figured it out and it would have been okay. She's just trying to reassure me, though. You don't know that people die all the time during surgery. And I am grateful that I had my crisis at home. I am so grateful for the support of my family members. My husband has been amazing through this, and he dives into learning all he can about both cancer and now adrenal insufficiency. And, you know, he makes sure that I take my meds every morning before I get out of bed, so that I don't get out of bed and fall because I have low cortisol, which isn't going to happen now, but it could have happened certainly during chemotherapy. And so if you can't find something positive in the condition that you're dealing with right now, that's okay. Don't feel bad about that. It's like, oh, this sucks. Cancer sucks. Adrenal insufficiency, it sucks. It makes you tired all the time, randomly. And okay, then you have to take a rest. And that's frustrating and it can suck. But the sunset is still pretty. My dog laying on my lap, all warm and shivering, is still, you know, I still feel loved, and that's a good thing. And the snow, it snowed a little bit in the last couple of days, which there's almost nothing left now, but it snowed a little bit in the last couple of days, and that was pretty. Snow is pretty. Even if you hate the cold, you can look at the snow on the tree limbs and say, okay, well, that's a little pretty. And just find something that's just a little bit less sucky and focus on that and smile about it. And then go about your day. And every time you start to feel like you're a victim and you're stuck and there's no way out, you can't go from there to being, oh yes, everything's wonderful. That's too far of a leap. You have to just say, well, let me look for something that's a little bit less sucky. Okay. That's a little, that look at that, person walking their dog by. There's not a person walking their dog by, but there was a few minutes ago. Look at that person walking their dog. They look like they're having a good walk. Like they're just, the person talking to the dog that makes me smile. That always makes me smile because I'm a dog trainer, but it makes me smile when I see somebody talking to their dog while they're walking and their dog looking up at them with that goofy, mouth open, tongue hanging out kind of smile. That makes me smile. Looking, scrolling on Facebook, there's often I get a lot of like inspirational memes, but I also get a lot of people feeling sorry for themselves because I'm in these support groups. And I don't know if I'll stay in a lot of these support groups. I'm still learning about adrenal insufficiency, especially. And I'm still going through cancer. So I still want to know from people who've been through it before what has helped them. So that's what I'm there for. But if the group tends to go around a lot of, isn't it just awful? Oh my God, I know it's just so awful. I'm not going to stay in that group because I don't want to put myself there over and over again. So that's kind of just what I wanted to say. There was a comment on my last video about how it's so hard to stay positive. And I get that. I do. But it's not if you don't try and just be super positive all the time. Like just find something that's a little bit less sucky first and focus on that. And then as you do that, as you notice yourself feeling bad, find something to feel good about, something in your day, something anywhere. My coffee was hot this morning and it tasted good. That was good. Sit with that for a moment and be grateful for that thing. And if you do that a few times a day, you will see more of the things to be grateful for because you're training yourself to look for them. If that makes sense. I hope that makes sense. All right, we're coming up on 20 minutes now, so I talk a long time. So let me know in the comments. Let me know what works for you to get yourself out of a funk. To focus on something that's just a little bit less sucky, and then the next thing and the next thing and the next thing. And before you know it, you're, a week later, you're seeing the pretty things and the things to be grateful for a little bit more than the things to feel bad about. And that's how we get there to being positive. And I do remind myself often that I believe that I signed up for this life, and whatever chapter I'm on now, I signed up for this for some reason. I don't know what it is yet. I don't know why I need to go through this particular challenge, but I came here to this physical existence in order to experience the challenge. And so there's only one way out, and that's through. And that's it. So let me know what you think in the comments. Hit like and subscribe. I guess I'm supposed to say that. I'm very kind of new at this. I didn't intend to make this be like a viral channel. But I've had a few subscribers now that are not my friends and family. So keep sharing if you think this is helpful. Share it, like and subscribe and all that stuff. And maybe we'll get monetized one day. I'm also going to put some links in the description below to these headscarves, because I've had people tell me that they like them, and they're very lightweight. It's stretchy like cotton, and all of the other hats and stuff for chemo I find to be too tight or too heavy and too hot. These are very lightweight and stretchy, and I've had other people tell me that they like them as well. So I'll leave a link to that and the other stuff in the description, my GoFundMe, my Amazon wish list, there's just my own Element link, which I'm not I'm not sponsored by anybody, but Element is the electrolyte packets that I drink, and if you use the link, enough people use that, I actually get credit so that I can get a discount when I buy it. That's all. It's not, but you can also, if you use the link, I think you can get a free sample pack if you buy something. So I think that's it. There's a couple other links. I'll put them in the description below of products that I use or like. There's a makeup one. I don't have any makeup on today, so it's not that, but you can't see what it looks like on me because I haven't done that. There's a video you can see in the little picture for the video. There's a video where I'm wearing makeup, and you can see what it might look like on my face in that video, but that's a few months ago now. My skin is just really thin, and I'm afraid to put makeup on it because I like even the natural makeup I'm using. Anyway, unimportant. I'll put some links below of products that I like, and you can maybe like them too. See you next time, everybody. Thank you.